Thank you for participating in the Visitor Infection Control and Prevention Training. This training program is required per the state's emergency order DEM 20-009. It is our policy to ensure that the facility staff work to reduce and prevent infection, disease, and contamination, and to maintain a clean and sanitary environment. With COVID-19, additional infection control precautions are necessary. We have worked to limit how germs can enter the facility. To this end, we have canceled elective outings. We use telemedicine when possible. We limit the points of entry and restrict visitors. We screen residents for respiratory symptoms, and we encourage resident respiratory hygiene. We also isolate symptomatic residents as soon as possible, and we work to protect our healthcare personnel and visitors by emphasizing hand hygiene. It's important to know the symptoms of COVID-19. These symptoms may appear 2 to 14 days after exposure. Symptoms include fever, cough, shortness of breath. Other symptoms may also present themselves, such as fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Anyone can have mild to severe symptoms. It's important to know that older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19. And there's growing evidence of transmission risk from infected people who do not have symptoms or before the onset of recognized symptoms. COVID-19 is thought to spread mainly through close contact from person to person. Some people without symptoms may be able to spread the virus. Person-to-person spread is the primary way that COVID-19 spreads. This happens between people who are in close contact with one another, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly they can be inhaled into the lungs. COVID-19 may be spread by people who are not showing symptoms. The virus that causes COVID-19 spreads very easily and sustainably between people. Information from the ongoing COVID-19 pandemic suggests that this virus is spreading more efficiently than the flu. In general, the more closely a person interacts with others and the longer that interaction, the higher the risk of COVID-19 spread. The virus may be spread in other ways. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. This, however, is not thought to be the main way the virus spreads, but we are still learning more about how this virus spreads. It is important to protect yourself and others. The best way to prevent illness is to avoid being exposed to the virus. You can take these steps to slow the spread. First, maintain good social distance, about 6 feet. This is very important in preventing the spread of COVID-19. Second, wash your hands often with soap and water. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Third, routinely clean and disinfect frequently touched surfaces. And finally, cover your mouth and nose with a mask when around others. Social distancing means keeping a safe space between yourself and other people who are not from your household. To practice social distancing, stay at least 6 feet or about 2 arms length from other people in both indoor and outdoor spaces. Social distancing should be practiced in combination with other everyday preventive actions to reduce the spread of COVID-19, including wearing masks, avoiding touching your face with unwashed hands, and frequently washing your hands with soap and water for at least 20 seconds. COVID-19 spreads mainly among people who are in close contact for a prolonged period. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. The droplets can also be inhaled into the lungs. Recent studies indicate that people who are infected but do not have symptoms likely play a role in the spread of COVID-19. Since people can spread the virus before they even know they are sick, it is important to stay at least 6 feet away from others, even if you or they do not have any symptoms. Social distancing is especially important for people who are at higher risk for severe illness from COVID-19. It is safest to avoid crowded places and gatherings where it may be difficult to stay at least 6 feet away from others who are not from your household. If you are in a crowded space, try to keep 6 feet of space between yourself and others at all times and wear a mask. Masks are especially important in times when physical distancing is difficult. Pay attention to any physical guides, such as tape markings on floors or signs on walls. Allow other people 6 feet of space when you pass by them in both indoor and outdoor settings. Washing your hands can keep you healthy and prevent the spread of respiratory and diarrheal infections from one person to the next. Germs can spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands, when you prepare or eat food and drinks with unwashed hands, when you touch a contaminated surface or objects, and when you blow your nose, cough, or sneeze into hands and then touch other people's hands or common objects. These are 5 steps to wash your hands the right way. Number 1, wet your hands with clean, running water. It can be either warm or cold water. Turn off the tap and apply soap. 2, lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. 3, scrub your hands for at least 20 seconds. You can hum the happy birthday song from beginning to end twice, and then you've got your 20 seconds. 4, rinse your hands well under clean running water. And finally, dry your hands using a clean towel or air dry them. Washing your hands with soap and water is the best way to get rid of germs in most situations. But when you can't use soap and water, you can use hand sanitizer. Make sure that alcohol-based hand sanitizer contains at least 60% alcohol. Apply the gel product to the palm of one hand. You can read the label to learn the correct amount. Then rub your hands together and rub the gel all over the surface of your hands and fingers until your hands are dry. This should take around 20 seconds. The CDC recommends that people wear masks in public and when around people who don't live in your household. Masks should not be worn by anyone who has trouble breathing, who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. It is important that you wear your mask correctly. First, you should wash your hands before putting on your mask. Second, put it over your mouth and nose and secure it under your chin. Third, try to fit it snugly against the sides of your face. Make sure you can breathe easily. The CDC does not recommend use of masks or cloth masks for source control if they have an exhalation valve or vent. Wear a mask to protect others. Your mask needs to cover your nose and mouth to help protect others in case you're infected with COVID-19 but don't have symptoms. Wear a mask in public settings when around people who don't live in your household, especially when it may be difficult for you to stay 6 feet apart. Wear a mask correctly for maximum protection. Do not put the mask around your neck or on your forehead. And do not touch the mask. But if you do, wash your hands or use hand sanitizer to disinfect. As a visitor, if you are sick or have had close contact with someone who is COVID positive, you must notify the administrator immediately. You must stay home and isolate yourself so that you do not infect others. And do not visit your family member here at Dayspring. So here are some general visitation rules per the state of Florida. We are eligible to allow general visitation when we meet the screening requirement of 14 days have passed since onset of the most recent COVID positive case. We are required by the state to schedule visitors by appointment and to monitor adherence to the proper use of masks and social distancing. Please call at least 24 hours in advance to schedule your visiting appointment. We are required to screen anyone who comes into the building. This includes staff, visitors, law enforcement, vendors, everyone. The screening process includes checking your temperature, screening for cough, shortness of breath, travel, screening for visitation to another nursing home, hospital, or assisted living facility, screening for close contact with COVID-19, and screening for crowds, including bars. As a visitor to Dayspring, please check and document your temperature every day and report any temperature over 99.6 to Doug Adkins. Please isolate yourself from others, wash your hands frequently, avoid large crowds, and always practice social distancing and wear a mask in public. During your visit, general visitors are not allowed to have physical contact with a family member or any other resident. Please practice social distancing. All visitors are required to wear a mask. Caregivers are required to wear gloves when providing direct care to residents. If you are touching the resident, you must wear gloves. And please wash your hands before putting on gloves. The CDC provides the following guidance on how to don PPE gear. 1. Identify and gather the proper PPE to don. 2. Perform hand hygiene using hand sanitizer. 3. Put on isolation gown. Tie all of the ties on the gown. 4. Put on an approved face mask. 5. Put on face shield or goggles. And finally, put on gloves. And your gloves should cover the cuff or the wrist of the gown. The CDC also provides guidance on how to doff PPE gear. First, remove your gloves and ensure glove removal does not cause additional contamination of hands. 2. Remove the gown and dispose in trash receptacle. 3. You would now exit the resident room. 4. Perform hand hygiene. 5. Remove your face shield or goggles. 6. Remove and discard your face mask. And finally, perform hand hygiene after removing your face mask. We want your visit to be enjoyable. If there's any concern with your visit, please contact the administrator, Doug Adkins, at 904-583-0134. We are committed to ensuring a safe, enjoyable visit for all families. Thank you for participating in this training video. We appreciate all you do to keep our community safe. For more information, go to www.cdc.gov.